My name is Julie Heckman. I'm the nurse manager of the Pediatric Emergency Department and Children's After Hours Care. I have been a pediatric ER nurse for going on 11 years now, and I've been at MUSC for 6 years. And I'm the co-chair of the Transitional Leadership Magnet Working Group.
And I'm Marilyn, Schaffner, Chief Nursing Executive and Administrator for Clinical Services. I've been at MUSC for 17 years and been a nurse for 39 years. I'm very excited that we're all here today to help formulate our nursing strategic plan. I just have a few slides today. We are going to be focusing on the transformational leadership part of the magnet model. And one of the goals or the priorities for the Transformational Leadership Work Group is to develop a nursing strategic plan. So that's what we're here to do. And just to recognize who's part of the Transformational Leadership Work Group, can you please stand? Julie Heckman, myself, Jennifer Collins, Andrea Coyle, Karen Driggers, Melissa Dunkerley, Chris Greco, Tess Hutchison, Amelia Little, Claudia Mack, Vincent Vernaccio, Dawn Vocalina, and Karen Weaver. And June Darby. I'm sorry, I missed June Darby. Those are my eyes. Well, thank you all. And this group is the group that sort of began our work a few months ago. So how do we approach this task? Well, we had the Transformational Leadership Work Group meet for about 2 hours, and we agreed on our plan. And we agreed that our strategic plan should complement the MUSC enterprise-wide strategic plan. It just made sense. We have a brand new enterprise-wide strategic plan that Stuart Smith's going to review with us. And then we looked at all of the different, you know, there are 7 strategies and 40 plus tactics, I think. And so we looked at all the strategies and we determined what strategies nurses could most impact. So we narrowed the focus for us today so that it would be more manageable. And as I said, Stuart's going to present the MUSC Health Strategic Plan, and Dave McNair is here, and he's going to be presenting why do this? Why do we need a strategic plan? And then together we're going to formulate the plan. So our timeline after today will be for Julie and I to present to multiple nurse forums. So the goal is you're going to develop the plan, and then we're going to give the staff nurses and nurses throughout the organization input, the ability to provide input. So we're going to use clickers in open forums, and they will determine which strategies we move forward with, or objectives rather. And then in July, Julie and I are going to finalize the strategic plan and then present it back to the Transformational Leadership Work Group for approval. And then July and August we'll be going out and doing some road shows and presenting the strategic plan to nurses throughout the organization. So let's get to work and let those bright ideas start flowing. And I promise you, it will not be a boring day. We have plenty of chocolate. If you run out of chocolate, just raise your hand. We've got some more. And we've got caffeine, and we've got a lot of good folks in the room, and I think we're going to have some fun. Thank you.